Hey everybody, Dr. D here, and as I've talked about previously, there are a lot of moving parts when we're attempting to identify the cause of a symptom and identify the appropriate intervention. And you've heard me say on a number of occasions that ultimately you and I and everyone are the biological end product of our interpretation of our perceptions. But that's a mouthful, and what does it actually mean? Well, what it means is that through the five senses, vision being the most important, hearing being the next important, and then smell and taste and touch, these are all impressions that come from the environment, they come from the relationships that we have, they come from the behaviors that we've adopted as a result of another concept you've heard me speak of frequently, which is core biological needs that we're born with, which if not met or not met sufficiently or not met over an extended period of time, as you continue to age, are going to contribute to your character. And as your character develops up until the point of about 6 or 7 years old, you then form a personality. And unfortunately, between the periods of 6 years old and mid-20s, 25, 26, 27 years old, the part of the brain that's responsible for allowing you to make appropriate decisions concerning the behaviors, the attitudes, the beliefs that you've adopted up until this point in your life that contribute to the thoughts, the feelings, the experiences that you have absolutely no way to interface with the main transformer, that being the brain, which takes this information through the senses, which are the impressions that ultimately become the expression in terms of your physical structure, in terms of your biochemistry, and in terms of your psychological, your emotional, and even your spiritual outlook. And so all of these things factor together. They're all related to the core biological needs not being met. They unfold in a specific and a very predictable series of influences that as you continue to age, the more you pay attention to what it is that you don't want, the more of what you don't want is what you're going to attract. And so ultimately this translates to a very simple sentence. Energy flows where attention goes. So if your attention is focused on what's wrong with your life, then what's wrong with your life is going to become more predominant and more difficult to deal with and lead to other feelings of despair, despondency, frustration, which ultimately are going to dictate not only your character, but the personality with which you interface with the entire world, all of the relationships that you have, and all of the experiences that you ultimately have in life. So over the next few videos, I'm going to talk more about each of these individually, show you some strategies for changing these behaviors and these beliefs so that you can actually transform your symptoms into solutions. I'm Dr. Richard DiCenso, and thank you for watching.